Hello, welcome to this med short, and in this short we are talking Narcan, also called naloxone. What is Narcan? Narcan is an opiate antagonist, which means we are using it on opiate overdoses with respiratory, don't know why I said it like that, depression. So this is going to be specifically opiates. This is not going to work on amphetamines, it's not going to work on benzos, and it's not going to work on a lot of synthetics unless they have an opiate component to them. So how does this work? Why does this work? So I have a crude depiction of what's going on before, and we have an opiate receptor here in yellow, and it is binded to an opiate. This is going to be portraying the individual who did some sort of opiate. We'll pick on heroin. So they have some opiate molecules from the heroin they did binded to the opiate receptors, and when Narcan enters the body, Narcan is going to take that opiate and it's going to bump it off that opioid receptor, and it is going to bind to it in its place. Now, this is not a definitive solution. Sometimes it is, sometimes it isn't. It really just comes down to which med is going to last longer in their system. And so that's why it is always safest to have these individuals be evaluated in the hospital. So we know what it is, we know when we're using it and why we're using it. Well, how are we using it? We are going to be, for adults, this is going to be up to 2 milligrams, and it's going to be IV, IO, IM, and intranasal as well. And you don't have to give this whole dose necessarily. It depends on kind of how you're giving it. The more control you have, for example, if you're giving it through an IV, you're going to have more bioavailability, and you can get away with giving less sometimes because it will hit a little bit harder. But the IN route, it is pretty difficult to do that as well. So what about PEDS? PEDS is going to be 0.1 milligram per kilogram, max of 2. If you guys have any questions, comments, concerns about Narcan, reach out.